What if the most common birth position today is actually the least natural? For almost all of human history, women gave birth in upright positions. They squatted, knelt on the ground, sat on low birthing stools, leaned forward on all fours, or stood supported by a rope or another person. In these positions, gravity works with the mother. It pulls the baby straight down through the pelvis and along the natural forward curve of the birth canal, while the tailbone can swing back freely, widening the pelvic outlet by as much as 30%. That changed in Europe during the late 17th and 18th centuries. As male obstetricians began attending more births, especially among the wealthy and in the first lying in hospitals, they discovered that a squatting or kneeling woman was difficult to examine or to use instruments on. It was far more convenient for them if the woman lay on her back at the edge of a bed. What began as a practical preference for the practitioner quietly became the medical norm. Within a few generations, the supine position, flat on the back, often with legs in stirrup, was taught as the only correct way to give birth. When a woman lies flat, gravity no longer assists the baby's descent toward the vaginal opening. Instead, the weight of the uterus and baby is pulled downward against the mother's spine and the bed, which opposes the direction the baby needs to travel. The final part of the birth canal curves forward and slightly upward over the pubic bone, so without gravity's help, the baby effectively has to move uphill during the pushing stage. At the same time, the sacrum is pressed against the mattress and cannot move, reducing the size of the pelvic outlet. Labor tends to last longer, pain intensifies, fetal distress becomes more common, and the need for forceps or other instruments rises dramatically. In the 1960s, French obstetrician Michel Audin challenged this model. He removed the delivery beds, dimmed the lights, kept rooms quiet, and encouraged women to move however their bodies asked. Many instinctively returned to squatting, kneeling, or leaning forward. Some stepped into warm pools of water for relief, giving new life to the practice of water birth. The results were shorter labors, far fewer interventions, and healthier outcomes for mothers and babies. Modern research has confirmed what traditional cultures never forgot. Upright and forward-leaning positions shorten the second stage of labor, reduce severe perineal tears, lower the chance of instrumental delivery, and improve oxygen supply to the baby. Because of this evidence, the World Health Organization and the American College of Obstetricians and Gynecologists now clearly state, women should be encouraged and supported to give birth in whichever position they find most comfortable. There is no medical justification for the routine use of the supine or lithotomy position in normal labor.